So today I'm going to do a recurrent head bandage for any type of head injury. And so before I do it, I wash my hands. I'm going to maintain privacy within the patient. I've checked doctor's orders and policy and procedures. And if there's any discharge, then I would wear gloves. But in this case, there's not, so I'm not going to wear gloves. And I want to do CWCM, check for color, movement, and warmth. And everything's looking okay, so I'm just gonna begin to. Oh, can I get your full name and your birthday, please?
Samantha Allen, August 5th of 98.
Thanks. Okay. Alright, so now I'm gonna start bandaging it. I'm gonna start with 2 circular turns around the head to anchor it, using my dominant hand to roll the gauze. Trying to avoid any wrinkles as possible. And now I'm going to flip it over top. And then flip it again. And once there. And now I'm going to do a circular motion around just to stabilize it again. And then I would use medical tape to stabilize the bandage, but I don't have tape with me right now. So after I have the bandage on, I would do another assessment of CWCM, and especially on any type of bandaging on distal limbs. You would want to keep the fingers or toes open so that you can check temperature, movement, and the color. And so are you in any pain right now?
Nope.
Good. Alright, so and I would also do a pain assessment before I put the bandaging on. I just forgot to mention that at the beginning of the video. Alright, so now I'm going to do a wrist restraint. And these can help for patients who might be at risk for falls, or a risk for injury, maybe possible violence. And so I just want to make sure that it won't be too tight when I put it on, and that can you move your wrist for me? Good. Make sure there's no injuries in place, no lesions or blistering or anything that could put harm at the patient. And it's even got like a nice soft pad so it doesn't hurt them. And can you tell me your first name, or your first and last name, and your date of birth, please?
Samantha Allen, August 5th of 98.
Good. And I've checked doctor's orders and policy and procedures, and maintained privacy if needed. All right. So. Did that feel too tight or too loose?
Nope.
And so then it would look like this. Just the 2 straps, and then I'm going to do a video of it closer up to tie it. Alright, and you would tie it to the bed. There's usually like a bed rail there. I don't have one on my bed, so I'm just going to show a video on how to actually just do the knot that you would normally do. Okay, so the straps would be tied to the bed rail, but I don't have that, so I'm just going to tie the knot just to show you what it would normally look like on the rail. So tie it under, flip it over, and then loop it through like so, and it would be nice and secure like so. And then to release it, you would just pull this and it comes undone. Okay, so before I would give the wrist restraint, I would make sure that I have the right size for the patient, and I'd want to make sure that they're comfortable and have gone to the bathroom beforehand. And then I want, once it's on, I want to check on them every 15 minutes to make sure that they're okay, make sure that there hasn't been any tightening on the wrist, make sure that there's no injuries or anything that they've caused, or any type of changes. And then I want to take it off every 2 hours and then check CWCM. And then I would just keep putting it back on and keep doing frequent checkups.